I am Morgan, and just a short video just to chat through some of our full arch implant options. What that means is that we replace all of your teeth on the top or the bottom or both, and it's perfect for patients that are currently suffering with a full denture. They're struggling with sort of how it looks, with how it feels. They've maybe lost confidence going out for dinner. They're worried about how it might come out when they're eating, and just generally don't like the feel of it. Also great for patients that currently have a partial denture, but the rest of the teeth are not looking too great. They may be suffering really badly with gum disease, or they're very broken down and carious. And we need to kind of look at the long-term options of possibly removing them as well. So it's a great solution for both patients with teeth that may be broken down and those suffering with a full denture that they don't like the feel of. Options that you have for full arch implants are sort of the main one, and the gold standard is the fixed bridge. What that is, it's a horseshoe shaped bridge which is majorly screwed in, so it's very strong, very secure, no movement on it, and you can have absolute confidence that you can go out for dinner and socialise, and it's been so rewarding seeing the transformations that fixed bridges can have on patients' lives that have suffered with the embarrassment of dentures for quite a long time. It's really, really rewarding actually. The second option is a removable bridge, or a telescopic bridge that we call it. So it's only removable on command essentially. So when we want it to be removed, we can flick it off so you can clean underneath it. And that's the main advantage of a removable bridges. It's for patients that we're a little bit concerned about the hygiene around the implants, and we want to take it off. It's also great for patients that want a little bit more support and bulk, if they've lost a little bit of, maybe their face is collapsed in a little bit with the loss of teeth, and they need more structure to reform some of their lip form and add a nicer, younger profile to their face. But in order to have that bulk, we need to be sure that we can take the bridge out to clean underneath it as well. And the last option is an implant retained denture. So it's essentially still a denture, and you're still going to have that same coverage over the palate, which might affect your taste and speech, but it has this little bit of extra security that it clips in and out, and you take it out and can clean quite thoroughly underneath it. Downside of it is you can still get a little bit of movement of it, obviously, especially on the bottom, and you can get some movement towards the back still. And with the components that you click the denture into, they will wear and tear with time, and they do need replaced. But it's very quick, easy and inexpensive to replace the little wee components within the denture that the implants click into. So if you want to know a little bit more on what maybe suit yourself, suit your budget, then please contact us for a free consultation about your smile transformation.